If you're watching this video, CPS may be working with your family to understand how to keep your child safe and healthy. We know this may be a very difficult time for you and your family. Our hope is this video can help ease some of the concern you're feeling by explaining what a child medical evaluation, or CME, is, what they are, who provides them, and how they can help you and your child. Children in the videos are actors and not real patients of child medical evaluations. We have, however, worked closely with the North Carolina Child Welfare Family Advisory Council to ensure information and content provided is what families who have worked with child welfare wish were clarified in advance of a CME. We hope this better prepares you and your child for the experience and what to expect from a CME. A child medical evaluation, or CME, is a special medical appointment that's being scheduled by your child welfare social worker. Because your family is involved with child welfare, there are likely concerns for either abuse or neglect. Our job as a CME consultant, as a medical provider, is to be able to understand the well-being needs for your child. And our focus during that appointment is to be able to make sure that your child feels comfortable sharing information about their experiences. The child medical evaluation provider is either a physician, a nurse practitioner, or a physician's assistant who has expertise in the diagnosis and treatment of child maltreatment. Their role is to function as a neutral provider and consultant for both you and your child welfare social worker.
We have the opportunity to see children from as young as newborns all the way up to graduating high school. The children that we see come with a concern for something that just happened to them, as well as concerns for something that happened to them a long time ago. Our main focus is to be able to help families with assessing concerns for abuse or neglect and making recommendations to improve the health and well-being for their child.
The CME is there for us to help CPS make a determination as it relates to a case finding. So it's there to see if the findings or the injuries are consistent with what we gain from our interviews, as well as it provides us with recommendations for services for the family moving forward. CPS will refer a child when there's concerns of sex abuse, when there's concerns of trauma, if your child have observed or been exposed to trauma, when there's also concerns of chronic neglect. Most of our sex abuse cases go through a CME. Most of our serious injuries will go through a CME, or children that's been exposed to traumatic events. CME does not cost anything for the family if it's referred through Child Protective Services.
We would never ask a family to pay for this exam. It's paid for by funding from the Division of Social Services or through Medicaid.
Signing the CME, or Child Medical Evaluation Consent Form, means that you're providing consent not only for the appointment to happen, but also for the medical consultation document to go back to your child welfare social worker. This means that document will be maintained in your child welfare social worker's files and will not be sent to your pediatrician or medical provider's office. You will, however, have an opportunity to talk to the medical consultant who completed the child medical evaluation to understand the recommendations and any diagnoses that were made during that appointment time. Many caregivers have questions about how to best prepare your child for the child medical evaluation, or CME. It's best to let your child know they're going to a doctor's appointment and to let them know this is likely a doctor or medical provider that they haven't met before. Encourage your child to be able to share information during this appointment so that your medical provider is best able to meet your child's well-being needs. If children have questions about the components of the physical exam or what will happen during that exam, please wait until the appointment to ask the medical provider what will be necessary during that appointment. When preparing your child for the medical exam that will happen during the CME, it's important to not make assumptions about what will occur. Instead, it's helpful to listen to your child and to bring questions up during the appointment to ask the provider directly and to help encourage your child to be able to determine before their exam what will happen. If your child has any comfort items, please bring them to the appointment so that your child is able to be more relaxed and confident during the appointment itself.
It's just important to say that we're going to go to a doctor's appointment because remember you had told me about those concerns before. They want to help to make sure that you're safe and healthy.
When you come for a CME, I'd like to kind of explain what to expect. The visit will take a couple of hours. It's pretty extensive. You will have an opportunity to talk to the provider before your child gets their checkup. The provider is going to ask you a lot of information about your child's health, behaviors, anything that you're worried about with your child. It is important for us to be able to speak to family members and get health history about their child. In some situations, it may be that the person that we're worried about, who may have hurt the child, we will not have them come to the clinic at the same time as the child, but we may speak with them at a separate time or by phone. They will also have gathered information from the investigator to make sure they understand everything that the investigator has been worried about.
If your child is over 3 and is able to participate in an interview, they'll meet separately with the clinic interviewer.
When we do that, that is often done by trained medical providers who know how to appropriately and developmentally speak with your child about their concerns for safety and health and well-being.
That appointment and that interview will oftentimes be videotaped. It's important that the parents are not in the room during that interview so that a child feels comfortable sharing information. Many children do not want to upset their parents or make their parents worry about their experiences. And if a parent was present in the room, that may limit what we understand about your child's experiences and limit the ability to do a complete physical exam and assessment of your child's well-being needs.
After we do this, then we will perform a physical examination. That exam is always performed with a chaperone, either that's a caregiver or with someone who is present there with the doctor.
During the physical exam, teenagers and older children will be asked who they want to have in the exam room. It's standard of practice in general pediatrics that teenagers are able to provide that information and make that decision. This appointment is all about your child and understanding your child's needs. So sometimes teenagers want their parents to stand outside the room, and other teens or young adults like to have their parents in the room with them. We leave it up to the child to determine the best setup and structure for their physical exam.
A child medical evaluation is a really comprehensive evaluation, like a well child check. We're doing things that you normally see happen with a well child check at your doctor's office. We're doing height, weight, we're doing blood pressure, heart rate, temperature, listening to the heart, listening to the lungs, doing all the physical exam that you see them do at the doctor's office.
One of the key differences in the physical exam that is conducted as part of their child medical evaluation is the genital exam or the private area exam. The way that the CMEP provider will conduct the exam is by getting your consent and getting your child's assent. This is true whether your child is 16 years old or if your child is 6 years old. None of the exams are done by force. Using gloved hands, the examiner will look very carefully at the outside part of the private area to assess for any concerns for trauma or infection, to assess their development and overall health and well-being. They will also look carefully at the inside. However, they do this without the use of a speculum. It is not like an adult woman's exam. It is not like a pap smear, even if the child is a teenager. The evaluation will always be conducted in the least intrusive manner possible. Anytime you bring your child in to see a pediatrician, they need to document the medical evaluation that they do. The typical way that most pediatricians will document is by writing into the electronic medical record, typing into an electronic medical record note or handwritten notes. Another way is through taking photos. That is something that you'll often see done in child medical evaluations. We want to make sure that your child is getting child-centered, trauma-informed treatment. In order to help facilitate that, we will take photos, and those photos of, say, the child's injuries or certain findings on their physical exam can then, in a very confidential manner, be shared with other professionals who are involved in the care of your child, without your child having to have unnecessary repeated evaluations.
At the end of the evaluation, I think it's really important to talk with kids and let them know about their bodies, what we found, and any concerns that we may have. We also thank kids for talking with us and explain to them how proud we are that they were able to provide this information to their families as well as to ourselves as medical providers.
As the caregiver, we will also talk to you after we finish the medical evaluation and help you understand what things we saw and whether we have concerns about those things and what our recommendations are. So you'll know before you leave the appointment if there are concerns that we think need to be followed up on.
We'll talk with you about the general health and safety recommendations that we're going to be making, any referrals that we think your child would benefit from, any additional testing that your child would benefit from, and how we would move forward from here in terms of their medical and health assessment. One of the hardest things for parents is remaining in a gray area for what might have happened with their child. Most of the time, children who report being sexually abused most often have a normal physical exam. So having a normal genital exam, a normal physical exam, cannot fully exclude that sexual abuse has happened, either recently or in the past. We will provide documentation that we've written, including notes as well as photos that we may have taken, to DSS for their review. Those records are highly confidential and protected. So for example, if parents have questions about what the recommendations are for their child, we are happy to address that during the clinic visit and then encourage them to collaborate with their social worker and DSS. Any decisions about custody, about safety, about placement are made by DSS and are not made by your medical provider.
The social worker is going to use that information to inform their assessment of safety for your child and making a decision about abuse, neglect, or dependency of your child, and also for safety planning, making sure your child is safe and that their well-being needs are met. So if an evaluator were to find that the child has other well-being needs like psychological or emotional health needs or physical health needs and needs referral, then the provider and the social worker will work together to make sure that the child is referred for those services.
We use the information to make a case finding. We use the information for court proceedings, for criminal proceedings, as well as for services for the family and for the child or the children.
Thank you for taking the time to learn about child medical exams in North Carolina. For more information, ask your child's social worker or visit the Child Medical Evaluation Program website.